This episode of Grandpa's Wisdom is brought to you by... Did you ever wonder? Why does my cat stick her butt in my face? Ew. Did you ever wonder, why does my cat scratch the furniture? Did you ever wonder, should I bathe my cat? Cats don't come with instructions. Now at patsanswers.com/blog store, you can get the answers. Zen and the Art of Cat Maintenance, paperback, $39.95 plus $5 shipping and handling. All major credit cards accepted. Buy it today. Health disclaimer. This blog provides general information and discussions about health and related subjects. The information and other content provided in this blog or in any linked materials are not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard medical advice or delay in seeking it because of something that you've read on this blog or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this blog and website have no relation to those of any academic, hospital, health practice, or other institution. We are now into our normal flu season, and along with the drum banging on the Chinese coronavirus, many of the health professionals are suggesting that everybody over the age of 6 years should receive this year's flu vaccine. Many will take this advice and then come down with some kind of illness. The reasoning behind this is simple. The vaccine stimulates your body's immune response, which temporarily actually reduces your system's ability to fight off other viral agents. Technically, this is called a cytokine storm. Understand, I'm not a medical professional, and the following is not in any way to be construed as medical advice. For many years, our forebears practiced folk medicine based on plants and herbs. My maternal grandmother was one such person. Elderberry, Sambucus negro, flowers and berries are used in herbal medicine to treat colds and flu, coughs, constipation, hay fever, mouth ulcers, sore throats, tonsillitis, rheumatism, herpes, wounds, bruises, and muscle sprains. The berries are also used in syrups, jams, teas, juice, vinegar, and wine. Elderberry juice is available in most health food stores, and it tastes delicious. Elderberries are considered a powerful expectorant and make useful additions to cough syrups. They reduce phlegm, stimulate the circulatory system, promote sweating, increase urinary flow, and, when applied topically, are anti-inflammatory. One of my grandma's home remedies was based on the berries of the elderberry shrub, which she would harvest in the early autumn and dry for the purpose of making an elixir to ward off the influenza, coughs, and colds. Elderberry tincture has long been known as the poor man's medicine chest for its usefulness, but especially its efficacy in treating cold and flu symptoms. Long used throughout Europe and the Americas, elderberry has a long and respected history as an herbal remedy. Both Pliny the Elder and Hippocrates mentioned and recommended elderberry as a medicinal herb in their writings. But there is a warning. The berries can look a lot like pokeberries, and poke can kill you. Poke is more like a weed with very wide leaves. The elderberry is more like a tree or a shrub. It has woody, hollow stems. Poke does not have woody stems. Elderberry is useful at 2 stages in its development. In the spring, usually sometime between April and early June, The shrubs will blossom with large umbels of elderflowers, referred to as elder blow. These umbels can be harvested, dipped in batter, and fried off as fritters. They're delicious, and the flowers have the same therapeutic benefit as the berries. The mature stage of elderberries are large clumps of dark black berries. These are easy to harvest. I dry the berries in a food dehydrator to preserve them for long-term storage, and I make two products for my herbal apothecary from the dried elderberries. The first is elderberry tincture. You need to take a quart-sized mason jar and fill it about a third full of elderberries, or fill the jar completely filled with fresh elderberries. Then you fill the rest of the jar with 100 proof vodka. Do not use a lower proof. You will not get the results you're looking for. You can substitute 100 proof bourbon in this case if you wish. Place the lid on the jar, label with the date, and keep it in a cool, dark place. Shake the jar at least twice a day for 10 to 12 days. Leaving it longer does not make it stronger, so there's no point in going any further than 10 or 12 days. Strain the mixture using a cheesecloth. Be sure to squeeze out all of the liquid. Store it in an airtight container on the pantry shelf for up to 2 years. To use it, for adults and older children, administer 1 to 2 tablespoons daily for prevention, and up to 4 times daily at the first sign of cold or flu symptoms. Because of the taste, which some people would find objectionable, it may be administered in a cup of hot or warm tea that has been sweetened to taste. The second product that I make is an elderberry syrup. Use 1 cup of fresh or a half cup of dried elderberries, 3 cups of water, 1 cup of honey, 2 tablespoons of grated ginger, which is a warming agent. Spices such as whole cloves and cinnamon are optional add-ins as well. Place the berries and the ginger, if you're using it, and the water in a pot. Bring it to a boil, reduce the heat, and then simmer over low heat for 45 minutes, smashing the berries. Then strain the mixture through a cheesecloth and add the honey. Stir it so the honey is completely absorbed. Bottle the syrup and store it in the refrigerator. It will keep for up to 3 months. Your dosages for a child: administer 1 teaspoon per day for prevention, or 1 teaspoon per waking hour at the onset of cold or flu symptoms. Adults, administer on the same schedule, however, increase the dosage from a teaspoon to a tablespoon. Take it within 48 hours of the onset of symptoms for adults and older children. This has been Grandpa's Wisdom on Pat Answers Archives. Stay well, my friends, and join us again next time.